Hospital, answering some of your questions on infertility, ladies. And of course, gentlemen, please don't feel left out. If you do have any burning questions on the same, go ahead and send them in. These are the frequently asked questions around this particular topic. So hot that we had to do it twice. This is a part B of what we had last week on Monday right here on K24. And of course, we continue to share with you our social media platforms and those numbers just in case you actually want to send those in at K24 TV. And of course, that WhatsApp number is at the bottom of your screen. You will see it popping up and down. So go ahead. We will be looking out for what you have to say. Okay, so we're going to start off with a text message that has come in from one Diana in Naivasha. Actually, it is a phone call. So Diana is on the line from what I understand. Good morning, Diana.
Hi.
Hi, how are you?
I'm fine.
Yes.
Okay, I went to a gyna.
Yeah.
And I was diagnosed with bilateral proximal tubal blockage.
Mm-hmm.
And I was told the only way to conceive is through IVF.
Mm.
So I'm asking the doc, is there any other cure or any other procedure I can go through without doing IVF as my last option?
Mm-hmm.
Yeah, that's my question.
All right. Thank you so much, Dr. What do you have to say about that?
Yes, I start by warning ladies that the minute you notice you have discharge, any type of an abnormal discharge, PV or through your private part, please dash to a doctor, a good doctor, because they think that blocked fallopian tubes is from heaven or I was born like that. No, they block from ordinary infections. So if you are free from infections, you will not get blocked fallopian tubes. Right. Now, to answer Diana, I want to say that if both tubes are blocked, there are some ladies, a very small percentage, that have benefited from something we call tuboplasty. Yeah. That is a microsurgical procedure where we open up the blocked tube. It depends on, a tube could be as long as 8 inches, 7 inches. Where is it blocked? Is it blocked towards the last end, the fibrio end, or is it blocked in the beginning, the cornwall end, or is it blocked in the middle? Yeah. So there are certain microsurgical procedures that can be used to unblock tubes. I have said that they are not absolutely 100% assurance that after tuboplasty or even fibrioplasty, that is when the tube is blocked towards the end and is the fibria, the finger-like projections of the beginning of the tube. If they at one stage the fibrios end up collapsing and joining, it's still a tubal block, and sometimes we slice them out. Yes. Okay? So she could try the fibroplasty or tuboplasty, whichever is the case. Yes. And I've said a few women have benefited. By and large, IVF is the only option. All right.
Let's tie that in with even some of the questions or the concerns that came in from Fatima and Marion. But before we do have another caller on the line, Safira from Wajir. Okay. Safira, good morning.
Good morning.
Yes, pole sana tulikuhata, but thank you for calling back.
Nilikuwa nauliza swali.
Yeah.
Mimi napiga kutoka Wajir.
Yes.
Naitwa Safira. Nauliza daktari. Mimi shinda yangu niko na watoto watatu. Na nimekuwa nikitumia family planning ya no plans for 3 years, sijapata period. Sasa nataka kutoa hiyo family planning, sijui nilikuwa nataka kufanyiwa TL.
Yeah.
Sasa sijui ataniadvise aje sababu niko na problem, weight yangu inaenda juu sana. I'm 40 years.
Okay.
Yeah.
All right, asante sana.
Asante Safira. Yes, you can get side effects of implants. That is, and I say the implants are high concentrations of mixed hormones. They are made long acting.
Yeah.
And they can interfere with the central nervous system, I must repeat, the hypothalamus, and can interfere with the pituitary glands.
Yeah.
And they can also interfere with the reproductive organs per se,
okay,
to make sure she does not conceive. By the time a woman chooses the method of contraception,
yeah,
she must have a good discussion with the doctor who is doing it, and or the team or the clinic, so that she understands the side effects. Like she has amenorrhea due to high doses probably of levonorgestrel, which is quite often in the high dose levonorgestrel in the implant.
Okay. All right. Margaret is on the phone. Margaret, good morning.
Good morning to you.
Yes, go ahead.
I am a mother of one.
Yeah.
And I have been using Femiplan pills, but I stopped like a year ago. Then I got pregnant.
Right.
But unfortunately, I miscarried after 2 months. Then I started receiving my period normally. Then after 3 months, they stopped. I stayed without period 3 months. Then they came back.
Yeah.
And then they stopped again. And I'm now 3 months down the line. I have not received my period. And I'm not yet pregnant. And I'm not using any contraceptives for the last 1.5 years.
Okay.
What could be the problem?
All right, thank you. You can see this question still keeps coming up. I have been on either family planning. I stopped. I've not received my period. In the case of Margaret, unfortunately, she had a miscarriage once she stopped using her contraception, Daktari. But it's pretty much tying into what the other ladies have been asking.
True, true.
Yeah.
And that's what we are insisting on. Sometimes you find the hormonal contraceptive can contribute to miscarriages. Because the minute you suppress, for example, the estrogens that are supposed to make or to build up the endometrium, and it is suppressed by a method of contraception, a hormonal contraception, then the baby doesn't have sufficient food, and the shall I call them roots? The baby will not have roots because there is no endometrium, good endometrium. It's like planting maize, like Jesus said, on sandy ground where there is no kuna udongo. There is no sufficient of humus and manure.
So going forward, even from this, Daktari, what are you saying? No hormonal contraceptives?
Absolutely not.
So what are you advising women?
I'm advising a discussion. A discussion of the lady, the gynecologist, or the obstetrician, or the team that is going to fix the contraceptive, and her husband or lover, wherever possible. It's very important to be told this is the possible side effect. This is not indeed only contraception. Even, you know, sometimes they end up with a pharmacist who doesn't explain side effects of any and every drug. Anything that you are influencing, you are taking internally or through an injection or whatever, and it is changing. It is changing your the anatomy, physiology, and your biochemistry. You should have a lengthy discussion, even when you pop a pill and swallow it. I want to say, like, even when we are treating pain itself, the basic pain, many people end up with stomach ulcers from painkillers. So it's the same thing that before you insert or you get injected, discuss, get to know the side effects.
Please, taking a look at your questions that are coming through our WhatsApp line very quickly. Let's put one up. I had a miscarriage last year, June. I wasn't cleaned, just given a pill. From there, when can I get pregnant? Also, we have been trying from December. Okay, keep a note on that one, Daktari, as we look at others that are coming in. Yeah, let's take another one. Tafadhali, Bwana Director. We've got Ken here who says, morning K24, on behalf of my wife, she had a stillbirth on the 8th month of her pregnancy. Since then, we have tried getting a baby again, but in vain. Could her blood pressure be an issue? Okay. All right. Do we have another one? Okay. We've got another one here that says, hello, morning. I'm using the 5 years implant for the past 17 months, but have not been receiving my menses. But all of a sudden, this month, I got my menses. Is that normal? Okay. Let's start off with the first one, Daktari.
Let me first tackle this tricky one of high blood pressure. And I want to include also high blood sugar in pregnancy. Yeah. They are risk factors, very big risks. Yeah. And the gentleman said wife and, she miscarried and she has blood pressure. We call it eclampsia. And there is also a period when before the full eclampsia, we call it pre-eclampsia. Yeah. And this is a blood pressure that has been induced by the pregnancy. Right. Or we also have pregnancy induced, to use a simple term, diabetes, gestational diabetes. Yeah, right. So this is the work of the clinic where she attends, the antenatal clinic. Antenatal clinicians, please take a good record, make a graph of blood pressure and blood sugar each time these ladies come to the clinic, because pre-eclampsia and eclampsia, quote unquote, high blood pressure in pregnancy and high blood sugar, diabetes in pregnancy, can cause a miscarriage. Right. And the worst bit is that usually, especially for pre-eclampsia, I'm repeating the word for the 4th time, pressure due to a pregnancy comes late in the pregnancy. Which after is the because you're almost there. Yeah, she's carried the pregnancy for so long. Yeah. This I would want to stress to the maternity and the antenatal clinics and doctors. Please keep a good graph, a permanent graph of a lady's pregnancy in as far as blood pressure is concerned, blood sugar is concerned, full hemogram is concerned, especially HB. Yeah. Let us check these things because there are ways of taming blood pressure. I think even for us to ask the questions when you go see your clinician and say, what does this report mean? When you see a percentage there, what is that? We are saying, and we are repeating, if your blood pressure, the upper one, let's use the layman's language, if the upper one is anywhere above 40, 140, I beg your pardon, 140, and also this blood pressure is given quite often free of charge. Yes. So get it checked, and pre-eclampsia can be prevented. Okay. I don't know if Najma is still on the line because I understand she's on the phone. Najma, good morning.
Morning to you.
Oh, yes. Good morning. Thank you for calling in.
Yes.
Yes. Question or comment?
Mine is a question.
Yes.
I have a daughter who is, she's almost 14. And she has not started her menses. But she's been having pains that she was saying are more or less feel like cramps. Yeah. And I thought it's good to take her to the doctor, and she was diagnosed to have some cysts growing. What could be the cause of this? And she's at a cause for alarm as a parent.
Okay, thank you so much for that. All right, Daktari, Najma's daughter, 14 years old, no menses yet, though cysts have been discovered. Yeah. Yeah, the cysts can bring infertility. Okay. And it looks like this is what we call primary amenorrhea. That means she has not had her periods yet. Yeah. And she's 14. Right. Now, the most likely thing is that she was born, like we said, with that small abnormality of no
hormones that are responsible for release all the ovulation or discharge of the egg.
Okay.
Probably the luteinizing hormone. I would suggest that she goes for a full hormonal profile because cysts.
Yeah.
And I want to say this one because it's a very common problem.
Yeah.
Cysts are a result of mature follicles or eggs that have not been released.
Okay.
It is not ruptured. The ovary is carrying those cysts.
Okay.
And it's a very common problem in Kenya. Some doctors have wanted to do surgery. Sometimes I say, first of all, let us check what is making this lady have the cyst in the first instance.
Yes.
Because you can even prick or do laparoscopy and prick or do cystectomy, but it comes back.
Okay.
So she has cysts. With the cysts, she becomes subfertile.
Okay. All right, Najma, I hope we managed to answer your question. Nevertheless, Eva is on the line from right here in Nairobi. Good morning, Eva.
Good morning, Shiko.
Yes, karibu sana.
Asante sana. Niko na swali. Na okay, niko na pain. Nilipata mtoi sahi yako 11 months.
Okay.
Na sijapata menses zangu. Nilipata menses once. Na ilikuwa kama day. It was dark.
Yeah.
And stinky.
Okay.
Alafu nimekuwa na pains.
Yeah.
Alafu hapa kando ya nini niko na naweza kwa Kikuyu wanazita ngai. Yeah, and it's painful, and then I have a chest pain.
Okay.
Yeah, na sengine inanifanya na katikiwa na breath.
Okay, thank you so much for that. We shall answer. Asante sana, Eva. Debbie, good morning.
Good morning, Shiko.
Hi, karibu sana to the show.
Yeah, I have a question.
Yeah.
I underwent a surgery. I had blocked fallopian tubes. And I underwent surgery.
Yeah.
So when I underwent the surgery, I was told that one side was damaged, but the other one was okay. So I was to survive with one.
Yeah.
Now, it was in October. Until now, I've not been able to conceive. I've been going to the treatment, Nikamua progesterone, G-Cochini.
Yeah.
I was given medicine. Now it's very high. It's 30.49. The last test I took. Now I'm not in any medication. I've not been in fertility pills, and I am 25. I don't know what is the problem.
Okay, thank you so much. We shall answer your question shortly.
Okay,
thank you. Okay. So we do have a couple of minutes to go, Daktari.
Yes.
Time is almost up. So I'm going to ask you to at least breeze through these, and then, of course, we'll be able to help them with your contacts so that they can talk to you further. When you look at Eva, just gave birth, has an 11-month-old baby, and her period has not returned. However, she is experiencing a lot of pain. She also does have shortness of breath. At the same time, she's experiencing cramp-like pains. So is it nothing to be surprised about, especially if you've just had a baby?
I think the old ladies, mothers.
Yeah. Who are the old ladies?
The mothers to these girls.
Yes.
The mothers
yes.
are not telling girls, because this is a very common question to me. When a lady gives birth, there is a hormone released by the same tissues, the hypothalamus and the pituitary, prolactin, which stops father. It's like itself a family planning method. So people stop getting periods after childbirth, and it can prolong for up to 1.5 years.
Okay.
And this prolactin makes the lady increases the flow of milk, and sometimes we even get it in women who don't have young kids or who are not breastfeeding.
Right.
Now, and they see milk sometimes 5 years after the last born stopped breastfeeding. So that is her problem.
Okay.
The cramp-like is because menses are trying to come, but at the same time she's breastfeeding, and they are. And by the way, she can conceive even when
lack of her menses.
The prolactin is on, so she better use a simple coil, something that will make her not become pregnant. The second one was?
Debbie just had surgery, almost ties in with all the other questions. And so, of course, now one tube, and this just happened in October, but she's already trying to get pregnant, and we're in February. Perhaps also you can see women almost being, for lack of a better term, impatient in terms of giving their body time.
Anxiety for a baby brings depression. And that alone mixes up the hormones again.
Wow.
So the lady you people must be patient.
Right.
You know, and finally, because I'm a Christian, and many of them are, even if they are Muslim, finally, I want to mention, and I mentioned last time, everything could be normal, and she still doesn't conceive.
Right.
We leave it to God. But let her do everything that she is in her capacity. Eat properly, sleep properly, get the right ingredients, avoid or do the sex acts on the right day. There are so many parameters. It's not singular. It's not like I said last time, date 13 is for a boy. And some people think date 13, on your marks, get set, a boy. No. It can be, you know, it's not that much fixed, you know.
Right. Okay. And I think that's the take home. Let's take one more text message at Daktari if we can, and then we'll say Kwaheri. Hi, doctor. I got lower sperm count, and I have gone to many hospitals and no reasons. Can you help me in regards to this gentleman who doesn't leave his name, but he's talking about low sperm count?
Not many men will want to be known that they have low sperm count. But men, this is your chance now. The low sperm count could result from a variety of reasons.
Right.
One of them, your lifestyle.
Right.
You drink a lot, you miss sperms. You take drugs, this, dawa za kulevya, you miss on sperms. You, by the way, Shiko, you overdo sex. Some people think that the more you have it, the more they will become pregnant. No, kutoa chakula kwa granary sio kurudisha. So sometimes they overdo it.
Okay.
The other one is men have certain organs themselves have a problem, like the epididymis or above the testes. Sometimes they get epididymitis, an illness. Sometimes the whole process of spermatogenesis, the manufacture of sperms from food, so to call it, it can go slow. You know, there is no sufficient of manufactured sperm. Now, I would advise the person to check the origin of his low sperm count. Where is it coming from? What is, and if he saw a good doctor, they will do an ultrasound scan of the testes, and they will do all other tests to find out why there is no spermatogenesis.
Okay, all right. So as we wind up, I would like to just leave it there, Daktari. But what I want all of us to take home is that there must be further testing and profiling done in order to be able to find out what the cause of all these problems are, because there is no single solution.
Not a single solution.
No single problem that could be the combination, or rather the reason for the infertility. Okay, so because of that, we want to encourage people to get in touch with you directly. The text messages are overwhelming, and so are the phone calls. So this is your opportunity to give Dr. Kibe a call. Take a pen, take your phone, whatever you need to write this number down. Dr. Kibe, go.
0722 53 4444. 0722 53 4444. Sometimes you can get me on Inyavio Kive. That is on Facebook and other social media platforms.
Yeah.
And we have an email for those who have a long story to tell. healthimprovement@gmail.com. One word. healthimprovement@gmail.com.
Okay.
We are in Coffee Plaza, right opposite Easy Coach buses.
Okay.
And get prepared, because we don't give snap answers like some people will expect.
Right.
We go through the whole process. I work closely with the University of Nairobi and other laboratories.
Okay.
Yes.
All right. So we hope that this particular discussion has been most helpful. Remember, that number is 0722-534444. On Facebook, you can catch him as Inyavio Kibe, and that email address healthimprovement@gmail.com. As Dr. Kibe likes to say, it's not just an issue for you ladies, it is a family issue. So go ahead, talk to your health practitioner, talk to your husband, or as Dr. Kibe likes to say, your lover about this.
Absolutely. It takes two to do.
It takes two to tango. All right, so let's leave it there, Dr. Kibe. Thank you so much for coming through. We appreciate your company. We'll see you soon. And on behalf of the team, Asante Sana for watching with you bright and early tomorrow, right here on K24 this morning from 6 a.m. to 9 a.m. God bless.